And it's complicated as far as the way the hospital gets paid. So I'm going to try to simplify this as much as I can. But the truth is that hospitals are not paid any differently for COVID 19 patients. The way we are paid has not changed. So the way we are paid is based on a patient's diagnosis and the resources that it takes for a hospital to take care of a patient with that diagnosis. So, in the case of a COVID patient, if a physician documents that a patient has COVID 19, that information is in the medical record and it's coded by a coder with a special code. And then that code is actually grouped into what is called a diagnosis related group. So for COVID patients, that diagnosis code would actually group to the DRG, the diagnosis related group for respiratory illness. And the payment for respiratory illness is the same for a COVID patient as it would be for somebody that's got, let's say, pneumonia that groups into that DRG. So that's how we're paid. The Medicare and insurance companies already have a set rate for that specific diagnosis related group. So we're not paid any more for COVID patients than we would be for other respiratory illnesses that fall into that same group. When we are paid more, it's because we've used more resources. So, for example, if a patient with COVID 19 has other complications and comorbidities, if they're on a ventilator, if they need special care because they have other chronic conditions like diabetes, dialysis, those other types of illnesses that go along with their diagnosis, then we might be paid more in those situations, but it's not specific to just COVID 19. I hope that clears that up. It's probably as clear as mud, but the fact is, we're not paid any more for COVID 19 patients than we would be for other types of respiratory illnesses.